Hey guys, this is an introductory video for those of you who are going to be helping me with the advanced airway rotation. And what we're going to talk about is fiberoptic intubation. I usually do this with patients asleep, and I have the equipment set up here. I think my opinion is that the battle is fought and won in the preparation, so there's going to be a lot of emphasis on preparation. So I'm just going to show you the equipment that I like. I like this style of video bronchoscope. This is the video bronchs are the best bronchs we have in the department, and this works really beautifully. So you have your light source connects into here. Light source, and the image goes through to the monitor through this connector.
Jim Mercer, calling 5, Jimmy calling 5, please.
Bronchoscope, very simple action, very simple device. Now, the preparation of this equipment, quick and easy, very simple preparation. What I do is I take the ET tube, needs to be lubricated, and the bronchoscope needs to be lubricated, but the easiest way is just to spray gently down the tube, then take the tube, we're using silicone spray, take the tube and mount the tube on the fibre optic as such. Take a little bit of tape. I usually prefer the orange ET tube tape, a little bit of tape, and place it into position. With the curvature facing towards the patient. Then, after we've lubricated, we want to demist. We want to make sure that the lens does not cloud up. So I take it, sterile, of course. This is sterile, clean bronchoscope. Dip the end, dip the lens in the demister solution. I'm using a size 8 tube for a standard patient, and the other piece of equipment I need is this little device. This is an obturator for a ProSeal LMA. We no longer use the ProSeal LMAs very much, but this obturator is very, very useful. I use it as a tongue lifter. So here we are. That's really all there is to the setup. Very quick and easy. But by passing the bronchoscope through the endotracheal tube, it lubricates the bronchoscope and the tube, and we are ready to go. The technique of intubation is very, very simple. For learners, these are first years on the advanced airway rotation. I have devised a very, very simple way for them to easily intubate. I ask them to familiarize themselves with this simple control, and that when the control is depressed, you get flexion at the tip of the bronchoscope. I draw their attention to the markings on the bronchoscope. This is the 10 centimeter mark, 15 centimeters, 20 centimeters. I ask them to insert the bronchoscope until it is 12 cc's, 12 centimeters at the teeth. Just before insertion, I ask them to apply a nice little degree of flexion, mirroring the degree of flexion or the degree of curvature in the pharynx, so that we can navigate the pharynx easily. I tell them when they are 12 centimeters at the teeth approximately, then stop. Then the assistant should insert the tongue lifter and lift the tongue out of the way, thus creating a nice empty space in the back of the mouth for the learner to visualize the larynx. I tell the learner to Flex and extend the tip of the bronchoscope gently until they see the larynx in the distance. They will see the larynx in the distance if the patient has fairly normal anatomy and the tongue is being effectively elevated out of the visual field.